guys, so I thought I would show you the exercises that I like to do while I'm pregnant to prepare for labor, as well as to just help my body as I'm going through pregnancy. So obviously, if you have any restrictions or if you have any concerns, I would double check with your doctor that you're supposed to be doing exercises like these. All of these have either been recommended by a physical therapist, a birthing professional or coach like Bradley, as well as the chiropractor. And I have found these to be really effective, and they're very minimal and very low risk. So this isn't an exercise video. So if you're looking for an exercise video, this definitely isn't it. This is just different stretches and things you can do to strengthen your muscles, as well as stretch certain muscles for birth and labor, as well as help with some pain that you can have during pregnancy.
Okay, so for this first stretch, you're going to want to make sure that you have some sort of flat surface like a chair or even a coffee table, and you're going to want to sit with your legs spread far apart. Put your elbows on your knees and then extend to straighten your legs. This will stretch the back of your thighs as well as your calves. This really helps to stretch the muscles in your lower back, and it can really help alleviate any sort of lower back pain that you're having. This is probably my favorite exercise when it comes to lower back pain. This next one helps to build strength in your thighs. You're basically going to do what you did last time, but instead of extending all the way, you're just going to go up a little bit and hold essentially a squat. So this really helps to strengthen your thighs, and this can be great for birthing and honestly just staying in shape during pregnancy. For this next exercise, you're going to take one of your legs and place it on the knee of the other and lean forward slightly. This will stretch right there along the side of your leg. I believe that's your hamstring. I'm not a physical therapist, so I don't know all the proper names for muscles, but it's really, really great for helping release some of that tension that gets built up. So for this next exercise, you are going to take a pillow and put it on the floor. I've actually even done this in my bed just fine. This is called Taylor sitting, and the pillow is placed just kind of towards the back of your bottom, and it helps kind of tilt your whole body forward. Bradley really tries to encourage this sitting position to help the uterus move forward, as well as increase circulation and stretch the inner thighs. This next one is one of my favorite positions to be in during labor, especially active labor. It really, really helps to shorten the birth canal and helps open up the pelvis. Bradley also claims that it can help shorten the second stage of labor. I have found that it can really help progress things in labor, but it's also just a really great stretch to do when trying to prepare your body and your muscles for labor. This is the position I'll try to get down in every time I have a contraction, and I'll have my husband do counter pressure. It's not the easiest to do by yourself, so I'd encourage you to hold on to the bed. For this next stretch, you just simply need a wall or flat surface, and you're going to put one foot in front of the other while extending the other one back, and this will stretch your calf and the back of your ankle. This is a really great stretch to do to help yourself get a better squat, like I just showed you in the previous stretch. You can hold this one for as long as you'd like, and don't forget to switch legs. So this strength building one is my least favorite to do because the further along you get, the harder it is. But essentially you're using the wall to brace yourself. You're gonna bend one leg, and then you're almost doing like a little bit of a half squat with the other. This really helps to build the muscles in your thighs. And again, this is all just really good for preparing your body for labor. Just be sure to try and keep your back as straight as possible while you're doing this. So for this specific stretch, you can do it, I've done it in bed or on the floor. Bradley claims that it helps tone and condition the muscles in your lower back and abdominal muscles. And again, it also helps relieve a lot of that pressure on your lower back, which is just really good for circulation and releasing tension. Remember to keep breathing really well while you're doing this, being sure to exhale and inhale fully. So this one is by far the most awkward of all the stretches, but essentially you're moving your hips in a big figure 8. I know it looks absolutely ridiculous, but this has been so helpful for relieving any sort of lower back pain that you have, and it really helps open up your hips. So this next position is really helpful for, again, releasing a lot of that pressure on your lower back and your muscles. It's also a really great position to be in for practicing Kegels. I will admit that this one can be a little bit hard to do if you are close to like the 39-week mark and have a rather large tummy like I do at 39 weeks. This one again is really great for if you're having a lot of lower back pain. You're going to rock your hips back and forth. You can even do this in bed to really help loosen up those muscles, especially if you're having bad sciatica nerve pain. If your back pain is super severe, this is an easier one compared to the next one that I'm going to show you, where you're just simply opening and closing your legs to build strength. This one, again, you can also do in bed or on the floor, but you're going to lay down on your side. And essentially you are opening and closing your knees, and this helps build up the strength in your hips. And by building some of that strength in your lower back, you can really help to alleviate some of that sciatic nerve pain. Don't forget to switch sides. This is a new exercise that I've learned, and it's one that I've been doing very sparingly just because of the diastasis recti that I have. This is very core building, but essentially you're pulling in your core and then you're using your toes to rise up on your arms and lift your knees. It doesn't look like much, but whew, I definitely was starting to feel it after filming this video. If you have any sort of diastasis recti or separation of the muscles, I would just make sure to keep a close eye on them, that they aren't separating too much and that you're really controlling your core. For this next one, you will need some sort of exercise band. You could honestly probably do it without, it just won't be as much of a challenge. I would start with a low tension band and then work your way up. But you're gonna put it just a few inches above your knees like I'm showing, and you're gonna get into kind of like a squat position. You're not getting super low. You are going to extend your legs and essentially shuffle in a straight line across the floor while doing your best to keep your shoulders, neck, and pelvic bone all in a straight line.
So that is it for the stretches that I have for you guys. If you have any stretches that have worked really well for you, I would love to know what they are. If I were to select a few of the exercises that I think are the most important, I would say doing the chair stretch, the chair squat, as well as the low squat. And that's just because I have done those for every pregnancy, and I have found that those have been the ones I can continue even when I have really severe back pain. So towards the end of pregnancy, those are the three that I like to emphasize the most. Do whatever feels best for you, whatever feels comfortable for your body. I would say don't push it. Start small, work up, and give your body lots of grace, knowing that you are pregnant and you are carrying a lot more weight and you're carrying a human being, so things are not going to feel the same as they did beforehand, and that's okay. I finished all those exercises and I tried to sit down here and film this and I couldn't even talk. I was so out of breath. That is it for this video, so thank you so much for watching. Bye.